We'll move on to our next proclamation, which is our 6.5 presentation of proclamation designating the week of April 7th through 13th, 2025 as National Public Health Week in Lake County. And Vice Chair Rasmussen will be reading this. Anyone who is here for this item, please come up as well.
Okay. Thank you.
Got everybody? What was that? A proclamation designating the week of April 7th through 13th, 2025 as National Public Health Week in Lake County. Whereas the week of April 7th, 2025 is National Public Health Week, and the theme is It Starts Here, highlighting the importance of making a difference in our home, community, and country. And whereas racial and ethnic minority populations in the United States continue to experience disparities in the burden of illness and death as compared with the entire population of the United States, and a person's health status can differ drastically by zip code due to differences in the built environment, environmental quality, community context, access to healthy food, access to education, and access to health care. Whereas public health organizations use National Public Health Week to educate public policymakers and the public on issues that are important to improving the health of the people of the United States, and the public health professionals help communities prevent, prepare for, withstand, and recover from the impact of a full range of health threats, ranging from infectious disease outbreaks to natural disaster preparedness. And whereas Lake County Health Services seeks to promote policies, systems, and services that promote optimal health and remove systemic barriers that result in health inequities, and strives to address the health disparities experienced by rural communities as a whole. And whereas the Administration Division supports each health services department program in its mission to promote and protect the well-being of local residents, and the Environmental Health Division enhances public health in Lake County through education, enforcing safety standards, and promoting compliance with environmental health laws. And the Public Health Division improves community health by providing information, resources, access, and services to Lake County residents. And whereas Public Health Week also recognizes the partnership and service of local public and private agencies, foundations, community partners, academia, and health-related enterprises that are working in collaboration to promote healthy behaviors and bolster the Health Services Department efforts in improving the health outcomes of Lake County residents. Now, therefore, let it be proclaimed, the Board of Supervisors of the County of Lake do hereby recognize April 7th through 13th, 2025 as Public Health Week in Lake County, passed and adopted this 8th day of April, 2025, and signed by our Chair, E.J. Crandall. Thank you.
I first off just want to say thank you to everybody on our staff for serving the residents of Lake County, for all the hard work you guys do year round. You know, I want to also assure you guys that, you know, with the dynamics of the political federal government going on, that I'm committed to you guys. I'm committed to Lake County. Public health is all about preventing suffering and keeping your guys' quality of life as healthy as possible and as long-lasting as possible. And I just want to let you guys know here that these servants, our public servants, are here for you guys, and we're going to do everything that we can to continue to make sure that Lake County is on the rise, both economically and in terms of our health. So I want to thank you guys all, and Layla, thank you again for 2 well-written proclamations this morning.
Anybody from the board? Yes, please come up. That's where I was just going next.
Okay,
Yeah.
sorry.
Yeah.
Hello, I'm Elise Jones, and I'm the Director of Lake County Behavioral Health Services. And in 2019, actually, I worked for the Health Services Department for 1 year, and then I went back home to behavioral health. But it was an incredible experience. I had no idea the range and scope of support that is done silently, that people have no idea. The fact that people don't struggle as much with lead poisoning, that tuberculosis is maintained. There's so many facets of our health that are taken care of so well that we take them for granted. And so I really applaud the Health Services Department and leadership for elevating the profile of healthcare and public health. You have an incredible staff. I know you know that. And I want to also thank you for your forward-thinking and progressive leadership. We consider health services like a sister department. And long ago, we were actually married. But things have changed, but we continue to have really robust partnerships, the SafeRx program, all of our efforts to combat the opioid epidemic that has impacted our community. So just really expressing my deep, heartfelt thanks, and also assuring public health, no matter what happens at levels of government that we don't have control over, I have never faltered in my belief that this community would come together for each other and that there are good people behind the scenes running our local government. So thank you.
Go ahead, Bruno.
I just want to add that there's been some great successes coming from the public health department in the last year or so, whether it's our mobile unit that is doing home visits currently, whether it's our tobacco, I was finding the words, but yeah, tobacco ordinances that have passed, or even right now, the work that's being done to update our CHNA, our Community Health Needs Assessment, and that helps us focus on making changes in our community. And the healthier we are, the more opportunities we will take to enhance and increase our quality of life, as you stated. And I appreciate all the work that's been done, and it's been turbulent at times, but I really feel like there's been a lot of progress in the recent times, and I appreciate all the hard work that everyone's put into it.
Just listening to this proclamation, it made me think of a couple things. Over the weekend, I went with a family member we have a situation with cancer, and so we all really don't know where all of it stems from. We know where a lot of it comes from when it comes to like tobacco use and all the other things, whatever you eat. But we still don't have it tied down, if that makes any sense. We just know it's a deal, right? And so with a lot of the work that you do to combat any of the listed, whatever provides the ailments, right? Whatever leads to it, you all do your work there. And one of the things I was thinking about in talking with my relative was that, 200 years ago, before that, of course they lived more healthier lifestyles because they had to make things. They had to walk. They had to they worked from, 12-hour days just to survive, and live. And so now we're not as mobile as that, and we eat different foods, but yet we do have these modern medicine, technology and different, cures for this at different times. And so I don't know. I think at times, your work, getting people out in the community, teaching them, like Supervisor Mtg said, getting the mobile clinics out and whatnot, plays a big difference. But at the same time, it's just being cognizant of a lot of these things, and so I'm glad that we're doing a lot of other work like parks and whatnot, so people can, have those types of other outreaches as well, and things to do. So again, thank you for this proclamation, and thank you all for the work you do. All right. Anybody else? All right. Sam, I think we're ready for your picture.
There we go. Okay, now I have everything. Oh, wait. Brad, I don't have you. You need me to? There, thanks. Yeah, now I have everybody. Okay. Okay, well, let me get one more. Okay, thank you so much.
Thanks, everyone.
Thank you.